Hi folks, my name is Dr. Steve Beyer. I'm a practicing chiropractor in Frankfort. I've been practicing for over 16 years, and we put this introductory film on our website. We also make DVDs with it, and I just want to give a little bit of introduction to what makes our clinic unique and different. As a chiropractor, obviously I treat structural problems, and even the way I treat problems structurally in our office is unique and different. We do, for example, non-surgical spinal decompression, which is very effective. But what really makes our office different is that we treat problems metabolically and neurologically. So you're either on this website because you've had some not too good results with the condition that you've had, or someone's giving you a DVD, someone who loved has given you a DVD to look at this. And so what I want to tell you is that in my office, we don't leave any stone unturned to determine the exact cause of your condition. And again, what makes us unique is that we treat problems metabolically and neurologically. So how do I successfully treat these different chronic conditions that I treat? Because that's what we specialize in, is chronic conditions such as thyroid disorders, including Hashimoto's. We treat type 2 diabetes, ADD, ADHD, peripheral neuropathy, vertigo, fibromyalgia. We have great success treating different chronic conditions. And how do I successfully treat these? Well, first of all, we use specific metabolic and neurological testing and treatments. The metabolic treatments that we use are based on specific lab panels that we use, or that we run. We run a thyroid panel. We run a complete metabolic panel. We run a lipid profile and a complete blood count, including with differential, checking the red blood cells and the white blood cells. And we do all that so we can assess your thyroid and your adrenal glands and your liver and your kidney and your different functions in your body. Check the different levels of red and white blood cells to see if they're out of the range there. All these internal functions can be affected by chronic health conditions. So by addressing any problem with your thyroid or your adrenal glands, and your blood chemistry, your gut function, we can help you heal faster, and we can successfully treat, again, these chronic conditions that all too often just don't get too good of results. And some other testing that we do besides that is we do sensitivity testing. We do different stool analysis to check to see if you're sensitive to different food items such as gluten or wheat or rye, oats and barley, milk and eggs and yeast and soy. If you're sensitive to any of these food groups, it's making your condition worse. It's just not going to get better. And so we test for that to see if you're sensitive to any of these things and get rid of it and help the GI tract or the intestinal tract heal. Here's just some of the symptoms that, for example, that you may have if you have sensitivities to any of these food items. You could get just chronic pain or fatigue, of course, frequent indigestion, bloating after eating, frequent loose bowel movements, constipation. You could get mouth ulcers or sores. So the only way to find out for sure, rather than guessing, if you're suffering from any of these sensitivities is if you run the test. Another metabolic test that we do is what's called a adrenal stress index. So we can check your adrenal glands. Your adrenal glands sit on top of your kidneys, and they play a major part in your blood sugar levels and a whole bunch of other things. So we do an adrenal stress index to see how the adrenal glands are functioning. Because if you've been or have been in the past or are currently under stress, this test is an absolute must. If you suffer from insomnia or blood sugar issues, this test is going to measure your cortisol levels is what it'll check literally. So when your body's cortisol levels are abnormal, then you're going to suffer from these different conditions like insomnia or blood sugar irregularities. So we do an adrenal stress index in addition to the sensitivity testing and the blood test that we do. We also we don't always, but we can actually do, and depending on the condition, check for immune panels to see if you have an autoimmune disorder. In fact, whenever we check the thyroid hormones, that's one of the things we always check for, to see if you have antibodies to the thyroid gland, because a lot of people, their thyroid condition is actually an autoimmune problem. So we can do an immune panel. We specifically can narrow that down if we have determined it's an immune condition, and see if the immune system is imbalanced. Basically, the immune system is broken down into two parts, the Th1 and Th2, and in a normal person it's balanced, and when someone has an autoimmune problem, it's greatly imbalanced, and we can do immune panels to see if it's in that imbalanced situation there. Some of the other tests that we do is sometimes we can do what's called a CD4 or a CD8 ratio to see specifically the immune imbalance there. We can check for H. pylori. That's a common infection that can happen with people with different GI problems. We can do that through a breath test. We also can check to see if someone has intestinal permeability problems or what we call leaky gut syndrome. We can do this by another stool analysis that we check. So we run these various metabolic tests and we can get a great assessment as to overall what the person's condition is and then specifically address it. We can evaluate for neurotransmitter imbalances. Sometimes we, depending on the condition, can evaluate hormone levels by measuring hormone panels. We can check to see if there's an irregular or too much inflammation in the body by checking what's called C-reactive protein and homocysteine levels. And we also can, as part of the treatments, use what's called glutathione treatment. So we do the metabolic testing, but we also, for our different chronic conditions, use glutathione treatment because this is the mother lode of all antioxidants. Glutathione can't be taken orally because it's not absorbed, and so what we do is we use it in a cream which is absorbed into the body, and glutathione treatment or supplementation through this way is very beneficial, we found, for these different chronic conditions. So the neurological treatments that we do are based on specific neurological testing. So we do the metabolic testing like I described, but we also, and this is another thing that makes our office unique, is we do neurological treatments based on specific neurological testing that we do in the evaluation to see if there's any imbalances within the nervous system. And there's more information on my website. If you're watching this DVD, you can go to our website, Frankfort BBT, that's B as in boy, BBT, that stands for brain-based therapy. The brain-based therapy are the neurological treatments that we do, and that can help correct these neurological imbalances that are often there with these chronic conditions. And again, this is another thing that makes our office totally unique than other offices that you've been to. So some of the neurological treatments that we do are, we do oxygen therapy because the brain has a high need for oxygen. We do different auditory, visual, and olfactory stimulation treatments to stimulate and activate the weak areas of the brain that we determine through the neurological exam. Some of the things that we do to do that are working with what's called interactive Metronome, which is a computer-based program that uses visual, auditory, and motor stimulation to increase the firing of the brain. You can look at their website. It's www.interactivemetronome.com. That's just one of the things that we do as part of the brain-based therapy. And again, on my webpage, Frankfort BBT, if you're not on the website and you're looking at this DVD, you can go to our website, frankfortbbt.com, and there'll be a bar up top that says, what is brain-based therapy? And it talks a bit more in depth about that. So once we've run all the necessary tests to determine your specific condition, we can successfully treat you via the neurological treatments or the brain-based therapy, and that combined with natural nutritional protocols that are based on scientific laboratory testing to specifically address what imbalances that we found. So I would ask you to just ask yourself a few questions, okay? How has your chronic condition affected your job, your relationships, your finances, your family, or other activities? How has it cost you in time, money, happiness, sleep? Where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? And what is it worth to you if we could improve your condition? If you could just ask yourself those questions and just consider taking me up on an offer that we give to people who are watching, who get this DVD from a friend or loved one, or have found their way to our website. What I offer is to do the first 2 visits in my office for a greatly reduced fee. We do it for just $50. Normally for what I do it'd be several $100s, but for $50 for the first 2 visits, here's what I would do. The first visit I would do that complete comprehensive neurological evaluation to see if there's any of those imbalances. If you have any lab tests that you've had within the last year or so, bring them in. I'll review them. One of the things that's not done right when it comes to metabolic tests and lab tests is that sometimes you're told you're normal, and that's because the ranges that the labs use are just too wide, and they need to use more narrow ranges. And so if you bring those lab tests in, I'll take a look at it and see if you're within a functional range. And just as an example, if your blood sugar level, if your glucose level is below 127, then you're told you're normal. If you get above that, you become diabetic. But actually, if you get above 100, then you're developing what's called insulin resistance, which is basically pre-diabetes. So you're outside of the functional range if you're outside of 100 with your glucose on your blood test. And so that's just one example, and that's why I say if you've had some lab tests, you may have been told, oh, everything's normal, when really it's outside of those functional ranges. If you bring those lab tests in, part of the first visit, I'll evaluate those and see if you are. In the first visit, we'll have you fill out what's called a metabolic assessment form and a neurotransmitter assessment form. And that'll help determine, just through symptom survey, if you have some metabolic disturbances. The second visit, I'll review the neurological exam that we did on visit 1. I'll review with you the metabolic assessment form and the neurotransmitter assessment form and what it's telling us, if there's any indications of there being imbalances. I'll do a case review if I accept your case, which would include, the case review would include reviewing what kind of treatment plan that I would recommend for you. And at that time, we'd review any kind of financial obligation there would be to go through the treatment plan. The only thing I ask, because I give a lot of information, it's hard to convey it, is if your spouse can make it with you, or if you have a significant other, and they're going to really know what I said, just bring them in. That's the only thing I ask. I do workshops, and sometimes people say, well, I can't go see you, Dr. Beyer, because I don't have a significant other, and don't let that hold you up. The point is that if you have a spouse, okay, if you have a husband, have a wife, or you have someone who's really going to want to know what I went over, then bring them in. Otherwise, it just, sometimes it just kind of lengthens the process, and we want to get you better as quick as possible. So this offer is only good, for people who've gotten this DVD from a friend or loved one, or if you've made your way to our website, or for people I do the workshops with. And I want you to know, I don't accept all cases, okay? I only accept those cases that I feel I can truly help. And I'll even refund the $50, okay, at the second visit if I feel like I can't help you. So you really have nothing to lose. And I want you to know that I need people to be on board. I'm looking for people not who are just, maybe I'll come a little curious. I'm looking for people who are looking to get better. What I call patients who are warriors, who want to get rid of this condition. Because that's how I approach this. I invest myself, and I spend a lot of time reviewing all this and developing these treatment plans if someone is a good candidate. So that would be what I ask, okay, is that you bring a spouse or significant other. Come, not just if you're looking to maybe kick the tire in a car and just kind of check something new out. If this piques your curiosity, and again, there's more information on the website, then you could look at that, and if this sounds like something you'd be interested in, you get those first 2 visits for $50. Our phone number is 815-469-8500. That's 815-469-8500. Speak to one of my staff. Tell them you've gotten a DVD or you saw this video on our website, and they'll schedule an exam for you. So thank you.